I believe we're moving into a very dangerous time, and this is why. The suicide rate has really gone up like geometrically. It is Suicide Prevention Month for mental health. And what's happening is that because of what has been needed to quell the virus in terms of isolation and people not being able to socialize, it has really been something that is very detrimental for people in terms of reaching out and able to help deal with their alcohol. And so what's happening now is people are isolated. They don't have their resources. There's no meetings. There's no AA meetings. Things are virtual, but they're not the same. There's a lot of disruption in services, or the systems are totally overloaded at this point. There's much less social interaction. People are lonely. They have cabin fever. They're feeling stir crazy, and they've taken to drink. I mean, well, I've seen around the globe, even in India, they had to shut down all the liquor stores in the country, lines wrapped around the block to get alcohol. They've interviewed people who own liquor stores. They say people who used to get liquor for 2 weeks get the same amount for 2 days.
No.
So it's really gotten out of hand. So there's the increased alcohol, there's the isolation that's happening, there's the national anxiety that's going on, that's on the news all the time. And then what we need to talk about here that we're not talking about enough is people who have ongoing mood disorders. There's a percentage that have seasonal variation. What that means is that in the late spring and early summer, just when we're going to hit the peak of the corona issues now, that's when people have mood swings. And here in Florida, we've had an early spring, it was 90s. And up north, they had a later spring, it snowed. So for up north, this is gonna happen just a little later, into June. And then we're gonna see people who have this seasonal mood variation are going to be extremely depressed. And what happens here is, unfortunately, there's an increase in firearm sales. That's the number one method of completed suicide, or firearms. So what happens is, it is like a perfect storm. People start drinking, people are worried, people feel insecure, unsettled, they don't know what's gonna happen. People who are drinking too much or have anxiety disorders, they are not the same, and this is much worse than people had before. And then people develop what we call tunnel vision. This is what happens when people get depressed. They can't see options, and then suicide becomes the option. I had listed almost 9 of them, but some of them that I really think that hits the mark here and are game changers is really a huge escalation in the amount of alcohol consumption. I mean, it's like people are drinking much more than they used to, and people that's number one, okay? Then we want to think about people who have underlying psychiatric disorders, mood disorders, etc. Those people have a great risk factor. And then we always want to think about the means. Do people have the means? In the hospital, I've been a hospital doctor for years. Nowadays, if anyone has a gun, it's like they call the FBI. I mean, no one with mental illness nowadays enters hospitals. They really, the guns are taken away from people. So, I mean, there's just 3 right there. Of course, we talked about the financial stuff. People lost their jobs, and people are just isolated. They can't even hug a friend. Nowadays it's gotten just out of control. I think it's just a game changer. It's like the new dark side of normal that people aren't talking about. And alcohol and drugs can really be a game changer. And finally, let's not forget, one very important risk factor is family history of suicide. When I hear that, that is a big red flag for me. Anybody who has any family history, and sometimes this is a big family secret, of suicide, they're at much higher risk. And there's a lot of reasons for that we don't need to get into. But people need to be aware, if there are suicides in the family, that you are at risk. I think it's not only the individual, but it's individuals around them. You know, teenagers have parents. Parents should be asking. Don't be afraid to ask, are you thinking about hurting yourself? So that is a very important aspect that people need to go and ask others. There's lots of hotlines, there's all services. Reach out, you know, so that in my office, I have to assess suicide continually. And what I do is I ask the patient, if they're with a family member, if you felt like really you got a plan, you're gonna hurt yourself, would you tell your mom, would you tell your wife? And unfortunately, I get things like, no, I wouldn't tell her. And then I say, oh, we got a problem here. That is a big problem. These kind of individuals, if they have a plan and they're not going to tell anybody, we need to call fire rescue and have them taken to the hospital, because these are dangerous people. So having a plan is a real ominous sign. Having the means, ominous sign. So certainly ask. And I think that's really an important message for family members and for people themselves. You know, they know, if they're not in so much major denial, that just if you think you're going to hurt yourself, you call 911 and you go to the nearest emergency room. I've seen it so often in the light of day when people are in the hospital for a day or so, or they just come to their senses, they've been to the emergency room, and they're so thankful they didn't go ahead and kill themselves, because they would never do it. And they realized it was something impulsive, like tunnel vision, not thinking of options.
BregmanMD Medical Group offers online psychiatry and online therapy.